choosing a healthcare plan can be a daunting task. There are many factors to consider, such as the cost, the coverage, the network, and the quality of care. In this section, we will guide you through some steps to help you compare different healthcare plans and choose the one that suits your needs and budget. The first step is to choose your health insurance marketplace. This is where you can shop for and enroll in a health insurance plan. Depending on your situation, you may have different options for your marketplace. For example, if you have a job that offers health insurance, you can get a plan through your employer. If you don't have access to employer-sponsored insurance, you can get a plan through the health insurance marketplace at healthcare.gov. If you qualify for Medicaid or Medicare, you can get a plan through those programs. The second step is to compare types of health insurance plans. There are 4 main types of health insurance plans: HMOs, PPOs, EPOs, and POSs. Each type has its own advantages and disadvantages, depending on your preferences and needs. Here is a brief overview of each type. HMO stands for Health Maintenance Organization. This type of plan requires you to stay in network to get coverage, except for emergencies. You also need a referral from your primary care doctor to see a specialist. HMOs typically have lower out-of-pocket costs and a primary doctor who coordinates your care for you, but less freedom to choose providers. PPO stands for Preferred Provider Organization. This type of plan does not require you to stay in network to get coverage, but in-network care is less expensive. You also do not need a referral to see a specialist. PPOs typically have more provider options and no required referrals, but higher out-of-pocket costs. EPO stands for Exclusive Provider Organization. This type of plan requires you to stay in network to get coverage, except for emergencies. You do not need a referral to see a specialist. EPOs typically have lower premiums and no required referrals, but less freedom to choose providers. POS stands for Point of Service. This type of plan does not require you to stay in network to get coverage, but in-network care is less expensive. You also need a referral from your primary care doctor to see a specialist. POSs typically have more provider options and a primary doctor who coordinates your care for you, with referrals required. The third step is to compare health plan networks. A network is a group of doctors, hospitals, and other healthcare providers that work with a certain health insurance plan. You should check if your preferred providers are in the network of the plans you are considering. You should also check how easy or difficult it is to access providers in the network, such as their location, availability, and wait times. The fourth step is to compare out-of-pocket costs. Out-of-pocket costs are the expenses that you have to pay yourself when you use healthcare services. They include deductibles, copayments, coinsurance, and other fees. You should look at how much each plan charges for these costs and how they vary depending on the type of service and provider. The fifth step is to compare estimated total yearly costs. This is an estimate of how much you would pay for each plan in a year, based on your expected use of healthcare services and your income level. You can get this estimate by entering some basic information like your zip code, household size, and income on healthcare.gov. Then, select View Plans and pick the level of care you expect to use this year. Finally, select Save and continue to get your estimated total yearly costs for each plan listed. By following these steps, you can compare different healthcare plans and choose the one that suits your needs and budget. Remember that choosing a healthcare plan is an important decision that affects your health and finances. Therefore, you should take your time and do your research before making a final choice.